I'm Raina Morgan with iHealthTube. We're visiting with Dr. Aaron Katz. What are some of the conditions of the prostate, and about what age would men experience an enlarged prostate?
Well, we see men that have an enlarging prostate, and this is called BPH, or Benign Prostate Hyperplasia, which is a benign growth of the prostate. And this condition can start in the 4th to 5th decade of life, but sometimes the symptoms of this condition are not really seen to the 6th and 7th decade of life. And the symptoms of a benign enlarging prostate are some of the urinary tract symptoms that we commonly see men complaining about, such as that they're getting up at night, they're having difficulty emptying their bladder, their stream is slower, they're going to the bathroom very frequently during the day. And this is due to the fact that this benign enlargement of the prostate is growing, and it's pushing on the urethra, the urinary tube leading from the bladder, causing higher pressures in the bladder. And that's very common to see a 65-year-old man who's coming in. He's complaining about these symptoms. He's not getting enough sleep at night. His wife is not getting enough sleep at night. And so they're seeking advice from a urologist to determine whether or not he has prostate cancer. For one, is this just a benign enlargement? Does he need medication? Does he need surgery? Or can he just try some dietary supplements and alternative medicine to relieve some of these symptoms?
So this benign condition is fairly common.
It's very common in men, and probably affects nearly half of the men as they enter the 7th decade of life.
Okay.
Now, a much less common type of problem that men face earlier on in life, usually in the 3rd or 4th decade of life, is an inflammation of the prostate, and this is known as a prostatitis. And prostatitis can be in two forms: as an acute prostatitis, where men have terrible pain in the beneath the bladder, in the prostate area, pain that's referred to the tip of the penis. This can be caused by bacteria, and this needs to be treated with antibiotics, usually for 2 to 3 weeks. A urine test needs to be done to determine what type of bacteria are present in the acute prostatitis, and the antibiotic usually is administered for that 2 to 3 week period, and for the majority of times this can treat and cure that condition.
So the benign condition, the BPH, that's just going to be an enlargement. You're going to have some urinary pressures and problems, but the inflammation, that you're going to experience pain.
In the acute inflammation, yes. Sometimes men can get pain, they can develop fevers, very high fevers, and if the prostate becomes inflamed very quickly and flares up, it can push on that urinary tube so much that men can't urinate at all. And they wind up, many times we see these men in the emergency room, and they have to have a catheter put in. That's acute prostatitis. Probably a more common scenario that we see in medicine is something called chronic prostatitis, where men have this inflammation in their prostate, and they do have some pain, but it's not the terrible pain where they need to be admitted to a hospital. They still can urinate, but they have vague abdominal pain, vague pain along the scrotal area, along the penis. We can feel their prostate on examination, and it feels inflamed and indurated. This is a chronic condition that sometimes needs antibiotics, but sometimes we found that some of the dietary supplements that we'll talk about can be very helpful in this chronic inflammation. And one of the concerns that we have nowadays with this condition of chronic inflammation is the potential association between inflammation and cancer. And if men have a chronic inflammation, are they at higher risk of developing prostate cancer? And can we block that inflammation so that we can block cancer development? A very key and important part of the complementary medicine for men with this prostate condition.
Thank you, Dr. Katz.
You're welcome.